enhancing MRI accuracy in rectal cancer, imaging innovations in staging, risk stratification, and reader confidence. We are presenting 3 recently published articles about the diagnosis of rectal cancer radiologically. Our first article, titled as MRI of Early Rectal Cancer, Bisacodyl micro-enema increases submucosal width, reader confidence, and tumor conspicuity. This was published in 2025 at the Abdominal Radiology Journal. In a prospective study of 50 patients with early rectal cancer, researchers investigated whether administering a bisacodyl microenema prior to MRI could improve diagnostic clarity. Each participant underwent MRI with and without a microenema. While sensitivity and specificity for T-staging did not significantly differ, the microenema led to increased submucosal width, mean 2.2 to 2.8 millimeters, improved reader confidence, and better tumor conspicuity. Notably, the proportion of tumors, both correctly staged and rated with high reader confidence, improved significantly from 58% to 80% for reader 1 and from 42% to 72% for reader 2. These findings suggest that a simple low-cost intervention like a microenema can meaningfully enhance MRI interpretation in early rectal cancer. Our second article was published at the Journal of Gastrointestinal and Abdominal Radiology in 2025. The study title is Staging of Rectal Cancer, MRI Protocol, Pelvic Anatomy, and Definitions. This review focuses on the essentials of MRI technique in pelvic anatomy, critical for accurate staging of rectal cancer. MRI remains the preferred modality for local staging due to its superior contrast resolution. Key elements emphasized include understanding the anorectal anatomy, mesorectal fascia, anterior peritoneal reflection, proper imaging planes, and the classification of tumor location, upper, mid, lower rectum. The authors also outline protocols recommendations, including sagittal, oblique axial, and oblique coronal T2 weighted imaging, and discuss high-risk features like mucinous adenocarcinoma, mesorectal fascia involvement, and tumor deposits. The paper provides a valuable guide for radiologists striving to produce structured, standardized reports that support effective multidisciplinary care. Our last article was published also at the Journal of Gastrointestinal and Abdominal Radiology in 2025. The study title is How Do MRI Findings Influence Rectal Cancer Management? MRI's role in rectal cancer has evolved from a staging tool to a critical driver of management decisions. This article emphasizes MRI's ability to detect high-risk features such as a mesorectal fascia involvement, extramural venous invasion, lateral pelvic lymph node enlargement, and tumor deposits, each with implications for prognosis and treatment strategy. The authors advocate a risk-adapted approach using MRI finding to stratify patients for neoadjuvant therapy, total neoadjuvant treatment, or direct surgery. Additionally, restaging MRI is highlighted for evaluating treatment response, helping identify candidates for local excision or non-operative watch-and-wait strategies. MRI not only guides treatment but also surgical planning, especially in low rectal cancer, where accurate depiction of involvement of the sphincter complex influences surgical approach.